So I'm talking to Dr. Richard Schaefer, who is an oncologist who treats Lederhosen and Dupuytrens with radiotherapy. Richard, can you tell me what is the risk of cancer after radiotherapy, specifically if you've used it in a low dose like you do for Dupuytrens or Lederhosen?
Good question. So radiotherapy, as well as being used for benign conditions, is also used in very high doses to treat people with cancer. But radiotherapy also has a risk of actually causing cancer, but just in the area that we treat. So for instance, it's not going to cause cancer, elsewhere in the body. It's not going to give people lung cancer or bowel cancer or anything like that. And the risk really is centered on the skin of the area that we treat. So if I treat your right hand, just in that area, it's just going to be that area where there's the risk. And really, although there's muscle and bone, it's just really the skin that has the risk of cancer. Now, how do we know what the risk of cancer is? That's the first question. And actually, there's no direct evidence, because what you would have to do is have to treat a certain number of people, then follow them up for the whole of their lifetime to see how many of them actually get cancer, and then compare it with the normal population. Now, no one's ever going to do that study. So we have to get that risk in an indirect way. And most of that is actually from things like nuclear disasters, which is a very odd way of getting it. And that's because people have a dose to their whole body from a nuclear disaster or nuclear bomb, that sort of thing. And then basically when they die, in the end, on their death certificate, it says how they died. And you would include the various cancers they might get. And so, for instance, if they have a skin cancer, generally they don't say where that skin cancer is. But if you imagine you have a certain amount of skin, and then if we just treat a hand, and we would divide it by the whole area of the body by that area just of the skin, we would divide that risk. And that's how we arrive at the risk of cancer in one particular region. So normally the standard way we talk about it is, let's say, 100 centimeters squared, which is roughly what a hand would be in terms of the amount of skin. And when they work that out, they work out the risk of death from cancer, which again is another indirect way, because really the question isn't how many people die from cancer, it's actually how many people get cancer. That's really what most people are interested in. And so again, we have to go indirectly to find that answer. And the risk of dying from cancer is about 1 in 5,000 lifetime risk for a 50-year-old male. So we don't really have the risk of getting cancer, but in my mind, I think, well, it must be less than that, of course. So I normally say, let's say 1 in 1,000 lifetime risk, just as a very sort of rough estimate. And that would be for a 50-year-old man. Now, if you're older, then you have fewer years to live, and therefore you have less of a risk in your lifetime of getting cancer from radiation. If you're younger, you have more years to live, and therefore have a greater risk of getting radiotherapy. So obviously that figure would be increased or decreased depending on that. The risk of cancer is mainly what's called a basal cell carcinoma, this type of skin cancer that in the very main doesn't spread anywhere. So one that doesn't kill you, in other words, that would be dealt with by surgery. And the average time to actually get that sort of cancer is 30 years, which is why for a younger person it's more important, for an older person it's less important. So obviously this is a very complex area. So we try and give a very simple answer. When I come up with 1 in 1,000, you can see that I'm trying to use a lot of quite complex indirect information to try and arrive at an answer that will actually have something to do with the person in front of me. So that's a pretty tricky thing to do, but at least you get an idea of around a 1 in 1,000 lifetime risk. If you think about your risk of getting a skin cancer from sunlight exposure, in other words, UV light exposure, that's much greater. I mean, it might be 5% or 8%, and then you compare that to the risk of, let's say, 0.1% from radiation to your hand. So it's really important you understand there is a risk of cancer, but it's very low.
Thank you for that.